President of the Trinidad and Tobago Registered Nurses Association, Idi Stewart, is dismissing the North Central Regional Health Authority's claims that there isn't a crisis taking place at the regional authority. At a protest outside the NCRHA, Mr. Stewart raised a number of concerns with statements made by the acting CEO of the NCRHA, Davlin Thomas, last week. Mr. Thomas said more than 45 nurses have already been accepted to the nursing pool at the hospital to ensure that all wards were adequately staffed and nurses were always available in the system. But Mr. Stewart said the nurses hired are junior staff and not permanent. The association's head also raised issue with the amount of nurses being placed on the evening and night shifts.
Nurses as permanent, hired nurses, the outstanding nurses who are home, over 100 of them, because there are vacancies. We want the immediate transfer of this continuous temporary to permanency, and we want the CEO through a scriptwriter to never again to make those statements he would have made and ensure that there's actually 3 nurses minimum.
The president of the Trinidad and Tobago Registered Nurses Association also called on registered nurses not to work on a ward where less than 3 nurses have been assigned.
That our friend, the CEO, Davlin Thomas, put out a release stating that he refuted our statement and that there's 3 nurses on every ward on every shift. We are so pleased he put out that. So now we will be telling nurses, anytime there's not 3 nurses on a shift where you work, do not work. Go to the nursing supervisor office, sit down, and let her know what is the policy position of the CEO.